Well, there are lots of them, but the one we're talking about today is, yes, the flu.
A couple of schools are closed, North Caddo and now Summerfield.
Do you think there should be more?
Well, the school closings are generally not recommended to be a routine thing. So that decision is made on a case-by-case basis based on school and school board and public health. And so it's not an easy decision to close a school. But if, half the teachers are sick or half the people who work in the cafeteria are sick, then that makes it really tough to have a good learning environment.
Doc, a lot of teachers are listening right now, educators listening right now. How long, if a kid comes to school with the flu, how long is that bug in the air and on the desks and in the cafeteria, et cetera?
Right. So the flu virus is not a very stable virus, which means from our purposes, it can live a few hours on a surface, but it's not going to live days. And so the general recommendation is that routine sanitizing, Clorox wipes, those kind of things, for desktops and for keyboards and things like that kids are interacting with, is adequate to kill the flu.
So this is not an airborne virus. Basically, if you and I have talked before,
it is airborne. I mean, when you cough or sneeze with the flu, you're putting out thousands and thousands of virus particles into the air. They don't hang in the air for extended periods of time like measles virus does.
But the number one prophylaxis, if you will, is to keep your hands washed and don't rub your eyes and put your fingers in your mouth.
Yeah, and cough into your elbow if you're sick. And, for parents, it's a hard debate about whether to keep kids home or send them to school. Kids, when they're sick, especially with the flu, they're not learning well. They really need to rest. They need fluids, and they may need antiviral medications to help, slow down the flu virus itself. So all those things, if your child's sick, they should stay home, and they shouldn't go back until they're fever-free for 24 hours.
Dr. John, how severe is the flu strain you're seeing right now?
The flu strain we're seeing right now is considered just a moderate intensity kind of strain. It's a good match to the vaccine, but not many people got the vaccine this year. Our vaccination
Why? Why
rates are
not?
low.
Why not?
Well, a big part of it is that in past years we've had the nasal spray flu vaccine, which we now know has not been as effective as we hoped it would, and it's not recommended this year because it's just not effective.
If you think your kid's got the flu, does this warrant a doctor's visit, or is home care 3, 4, 5 days going to take care of everything? What would you think?
Most kids are going to do fine with the flu and with home care, but and that's always a parent's judgment call. If your child's not eating or drinking well, especially if they're a young child that's not drinking enough fluids, I mean, they're not going to eat very much when they have the flu, but they should be drinking and urinating enough to keep themselves,
In other words, basically look for dehydration and things like that would be flu-related, not necessarily the virus itself.
Correct.
Is it too, we're talking with Dr. John Vanchiere, lots of letters behind his name.
Nice.
Is it too late to get the flu shot?
Well, it's not too late to get the flu shot. We do recommend it into the spring because we may still have flu circulating in our community for another 6 to 8 weeks. And there are multiple strains circulating now. So it's not too late to get the flu shot, but remember that, number one, the flu shot isn't 100% protective. No vaccine is 100% perfect. And number two, it takes about 2 weeks for your immune system to sort of kick in and use that flu shot as it's, to tell it how to respond when it sees the real flu. It's like a fire drill for the flu, but it takes 2 weeks for it to sink in.
Okay, for people like me who got the flu shot, are there some things I should do, some people I should avoid, or places I should avoid going?
No, not in particular. Wash your hands. If somebody's sneezing and snozzling all down the road or in the elevator, you probably don't want to shake their hand or take the doorknob after them, and you just want to be prudently cautious.
Dr. John, in a little different direction, you see year in and year out that various strains of the flu are most dangerous, can be more severe for older folks. Is that the case this year too?
It typically is. I haven't seen any data to tell us that we're having particular trouble, but remember that, children are the general vectors for flu, especially, a toddler with a glazed donut-looking face is going to be spreading flu, and as soon as they jump up on Grandma's lap, then Grandma's going to be at risk. So,
did you really just say toddler with a glazed
donut-looking face? Yeah.
Well,
we know
I get you.
We know what you meant. You just described Matt, as a matter of fact.
Yeah. So I can still get the shot, but washing of the hands is critical.
Washing hands and yes.
Pardon me, Doc. What's Robert's rule that you always make fun of me for?
You don't touch yourself above the neck
without washing my hands first.
Okay, and one more quick thing with the couple of schools that are closed. What's your advice to those folks? What's critical for them to take care of to make sure they're safe? Their school is safe for the kids to return.
Well, as I said, CDC has very good guidelines on their website. They're accessible to everybody, and routine sanitizing, wiping down desks and keyboards and things is perfectly adequate. You don't have to fumigate. You don't have to wipe down ceilings and walls and all those kind of things. It's just the routine cleaning is adequate to get rid of flu.